Hi, Dr. Ron here, and I want to invite you to join our Unstressed Health community. Now, like this podcast, it's independent of industry and focuses on taking a holistic approach to human health and to the health of the planet. The two are inseparable. There are so many resources available with membership, including regular live Q&As on specific topics with special guests, including many with our amazing Unstressed Health Advisory panel. Now, we've done hundreds of podcasts, all worth listening to, with some amazing experts on a wide range of topics. Many are world leaders. But with membership, we have our Unstressed Lab podcast series, where we take the best of several guests and carefully curate specific topics for episodes which are jam-packed full of valuable insights. So join the Unstressed Health community. If you're watching this on our YouTube channel, click on the link below or just visit unstressedhealth.com to see what's on offer and join now. I look forward to connecting with you. Well, this is really part two of our biohack exploration. Now, last time we spoke in part one, it was with Camilla Thompson and Azra Algich, and they spoke about shockwave therapy. And I must admit, I was not familiar with that therapy, but as you will hear today, it is an interesting thing, an interesting form of therapy, an interesting use of energy to stimulate circulation and to really get some positive biological responses. My guest is Dr. Adam Gavine, and Adam's background is chiropractic, but he is an expert in shockwave therapy. His company, Wasabi, which we talk about that name in this podcast, is leading the way in shockwave therapy in collaboration with the legendary in the biohacking world, Dave Asprey. Now, biohacking, as I said in the first part, is another expression for what we used to call trying to be as healthy as you possibly can, but it taps into a whole lot of other modalities, of which shock therapy is one. Now, Adam's chiropractic background stimulated my interest in how he would approach chronic musculoskeletal pain, which has been of interest to me throughout my 45 years in practice. So I hope you enjoy this conversation I had with Dr. Adam Gavine. Welcome to the show, Adam.
Hi, Ron. Thanks for having me on. It's a pleasure to be here.
Adam, you are a chiropractor, of course, and chiropractors deal a lot with chronic musculoskeletal pain problems, and it's an area that I've been very interested in for my entire career, over 40 years. And the thing that often surprises me, and I think frustrates many patients, is they go for a CAT scan, an X-ray, an MRI, and it all comes back normal, and yet they're in terrible pain, and the doctor says, look, all the tests are normal. It's all in your head. What do you think causes musculoskeletal pain? Big question there, I know.
Yeah.
What do you think?
It's a good question, but there's no simple answer. It's funny because I just listened to Dr. Stuart McGill on Andrew Huberman's podcast, and I know Stu, and I've been to his seminars, and it's funny. I could tell he was kind of biting his tongue because he doesn't like to answer generic questions. He goes, I can give you a specific answer if you give me a specific question. So it's like 45-year-old male with this injury caused by this, has this comorbidities. He needs context, and then he can properly answer the question. So I'm kind of similar because he rubbed off on me.
Yeah, well, let's say somebody's come in with, headaches that they've been suffering from for the last 25 years, and they get 2 or 3 headaches a week. You've probably noticed this too, where you ask people, how often do you get headaches? And they go, not very often. Yeah. And you go, how often's that? And it's 2 or 3 times a week, which is shocking. Yeah. But for some people, that's not very often, and others it is. But someone like that, what are we looking for that gives us a hint that there's something actually wrong?
Well, kind of my area of expertise is really the biomechanics. So I'm really focused on the biomechanics, and that's kind of my job when people come to see me. Is if you come to see me and you have neck pain or headaches, my job is to figure out, is it biomechanical, musculoskeletal, or not? Those are kind of my options. And usually the real easy way to kind of figure that out is with musculoskeletal or biomechanical, I should be able to reproduce the pain, and I should be able to find a way to alleviate or somewhat diminish the pain, or find a position that makes it better. Whereas if it's like a type O condition, which just means it's non-musculoskeletal, it won't really matter. Like if your neck pain is due to like a disease, like if you have rheumatoid arthritis, or you have some other like autoimmune disorder or something like that, then it won't really matter per se what I do to make it better or worse. Whereas musculoskeletals, there should be basically like a poison and a cure. So for low back, what Stu McGill talks about, like, so if you're flexion intolerant, bending forward is the poison. So you need to eliminate or reduce that, and extension will be the cure. So if someone's coming in with back pain and they keep bending down all the time, I got to stop them from doing that. And then I got to get them to start doing extension to alleviate their problem. But I'm still using the musculoskeletal system, but I'm using it in a manner that's not going to piss off the problem. It's like Stu says, don't pick the scab. And my mentor used to say, when people used to pick the scab, he'd be like, congratulations, you've just bought yourself another day of back pain.
Right.
Because it's not that you have a complex problem. It's just like if I had a scab on my arm and every day I picked it and it bled, and then I said, oh, Dr. Ron, why does my arm not heal? Why does it keep bleeding? And you're like, well, Adam, because you pick it every day. And therefore the healing process never gets a chance to finish the job.
Yeah. Yes. I mean, in your experience, people, putting aside a diagnosis of autoimmune or rheumatoid arthritis and that, where they've had some history of a trauma. I mean, I think people often don't realize that muscles have got a long memory, really, don't they?
Yeah, of course they do.
How long would someone, a trauma be significant to a person's pain experience?
Oh, it can be decades. It can be decades. Like, I've had people where I can tell just by the feel. Once you've been doing what I do for long enough, you develop this tactile sense, and we'll segue into this later. But I do myofascial release called ART, and the master, Dr. Mike Leahy, who invented it, he's a freak. Like he would work on people and he would feel their tissues and be like, this feels like you probably did it about 12 years ago. And he would be within a couple years, like all the time. It was like freak. He'd go to another person and be like, oh, this is like 3 years ago. Another person would be like, this is at least 30 years old. Just by that, because he could tell by how the tissues move and felt, and whether they had been stuck like that for a long time. It's almost like they harden, kind of like rust on a piece of metal. You can just feel, and based on how it feels, you can establish how long they've had it. But if you really badly sprained your ankle when you were a little kid, you can still have problems related to that. Not only, a lot of people get stuck on just the musculoskeletal component, but there's the whole neurology. People forget, like, all of these soft tissues have a direct connection to our brain. And our brain has, the way it had explained to me on a podcast was really cool, is our brain has a 3D map of our entire body. And all our sensory nerves and our sensory organs, whether it's, all these mechanoreceptors in muscles and joints and ligaments and tendons. They're constantly working with the brain. So it's a back and forth. So the brain's going, hey, how's that ankle going down there? And then the ankle sends a signal, all good here, boss. Or vice versa. It'll go, hey, boss, we're having troubles down here. We tore some ligaments and we strained some muscles and we're really unbalanced in here. And then the brain goes, okay, I'll send some help. And then your body will make accommodations to get by. And so if you weren't able to recover fully from that ankle sprain and you had some ongoing deficits due to that, like you tore those ligaments and they, because ligaments, they're kind of like a slinky. You know, if you pull a slinky really far apart, it never quite goes back to its original shape. Mm-hmm. Ligaments are like that. So if you sprained your ankle, it will never be as taut as it was prior to that sprain. Yeah. So now you have a lot more joint laxity. So that joint's kind of sloppy in a way. And then that slides around and moves, and then that leads to some osteoarthritis because that joint's not meant to slip and slide around all the time. And it rubs and it rubs and it rubs, and all of a sudden you get wear and tear from that. So that's what happens in our neck and our back. Usually low back pain is the most common one is disc problems. And they're often due to joint laxity. The joints themselves, the vertebra become unstable. Then when you bend forward to pick something up, you have, instead of just having flexion, you have flexion plus translation. And that translation leads to a shear force on those discs. And the shear force is what damages or irritates those discs.
And then this kind of gets to the point of also when people are in pain, they will see different practitioners, and chiropractors, osteopaths, physios are generally where they go. I know the lines are often blurred between those, but how do you characterize the difference between those? Is there a difference, or is it just in spelling?
Well, there is a difference. We all, and the thing to point out here is that just because I'm a chiropractor doesn't mean I'm going to treat like all the other chiropractors. It really depends on when you studied. It depends on what university you studied at. What techniques you're fond of, because like there's certain techniques that I just wasn't that good at, so I kind of shied away from those ones, and other ones that I liked or I was good at, and I just kind of stuck with them. So you can see essentially 10 different chiropractors and get 10 different treatments, even though we went to the same university, right? So I tell people, and I talk about this in my book. I wrote a book on back pain, which I can show here a few years ago.
We'll have links to that. Yeah, we'll have links to that.
So in the book, we actually have a chapter on how to figure out whether you're seeing a good practitioner or not. There's like a checklist.
Okay.
And so we enumerate the basic attributes that a proficient, professional, good practitioner should have. And we actually do the opposite too. We show you like what bad practitioners do. So
can you share with us a couple of those little points? I mean, you don't have to list them all out.
Yeah, well, just some basic ones are just whether they take a thorough they conduct a thorough history. So they talk to you about, like what we were talking about earlier. It's all these context things, when you had injuries, whether you had any surgeries, little things like how's your diet, how's your sleep, how's your exercise, how are your stress levels, how's your family life, all of these things. It's a confluence of things that affect how our body functions. Yeah, like that you've written a book on it essentially. And so all these things kind of chip away at, like, if we talk about like a baseline of optimal health, all these things keep moving us further and further away, like a standard deviation or two away from that optimal. And that's when we develop these conditions or diseases. So like I listen to like guys like Dr. Mark Hyman, and that's what he talks about is we need to stop looking at treating disease and start looking at people and going, how do we optimize health? Okay. When you're sick, you're clearly one or two or three standard deviations away from the optimal health. Instead of going, oh, we're going to treat those conditions, all I got to do is restore health, restore health, restore health, right? Get your sleep better, get your nutrition better, get your stress down, get you doing things you enjoy, get you doing some meditation, some breath work, all these things. And the cool thing is, like with biohacking, there's like a menu. It's like when you go to a restaurant, you can pick what you want. You don't have to have everything on the menu when you go to a restaurant. You go, oh, I feel like chicken tonight, or I feel like the beef, or I want a vegetarian meal. You can have whatever you want. And that's what I encourage people to do, because some people are like, oh, I know I'm supposed to go do a sauna, but I hate it. It's uncomfortable. And I'm like, well, don't do it. It's like, go do red light therapy, or go do PEMF, or go do meditation. Or like, there's so many things you can do to restore health in one capacity or another. And that's what's so cool about it, is there's so many options.
Yeah. One of your options, I want to talk about biohacking, obviously, but coming back to your active release technique, and you tell us a little bit about that.
So active release is essentially a myofascial release technique. So basically, I'll just kind of give you examples. So if I'm working like the forearm flexors here, so basically I'll take the muscles I'm working and put them in a shortened position, and then I put a little bit of compression as well as tension on those tissues. And then I'm going to lengthen those tissues under tension. And then I reset, and I'm going to go in again, and I'm lengthening those structures underneath my hand. So essentially, again, like I was talking about with all those mechanoreceptors and proprioceptors, and in here, I'm not, a lot of people just think you're breaking up things. It's a neurological modulation.
Okay.
I'm telling the brain I'm updating the app, that 3D map in your head. I'm updating it, because after a while, if I don't move something for a while, that 3D map becomes kind of blurred. Like the picture of the map becomes blurred. And then the communication between my forearm and my brain isn't as clear. My brain's going, hey, what are you doing down there? And my forearm's like, oh, I'm not really sure. I can't quite move as well as I used to. And then your brain just goes, oh yeah, whatever. We'll deal with it later. Whereas if I'm giving that part of my body stimulus, I'm updating that app. And then my brain goes, oh, I remember you. Now we can get that to do what it used to do. And that's the beauty of it. That's really even something you've had for decades. Yeah. I've had people with shoulder problems they've had for did 20, 30 years ago. And I get in there and I break up the gunk, the adhesions and all that. And I update the app, and all of a sudden they're like, oh my God, I can move my arm again.
Yeah.
And
I had a very similar experience with a practitioner from an injury that I'd had 20 years before. So this is music to my ears and what I'm familiar with. But I think this is the point, isn't it? The one with an injury, there's compensations.
Yes.
And when those compensations get hardwired into your brain, you start to have problems called chronic pain. And the irony of chronic pain is that it's not where necessarily the problem may not be necessarily where you're feeling the pain.
Yes. And that's like what we kind of talk about in the book about being a good practitioner. A really good practitioner will take the time to figure out what the hell's going on. Whereas an average practitioner, you just go, oh, it hurts here, doc. And they go, okay, let's start there. And it's like, well, that wasn't hard. They kind of told you. I'm always questioning in my head. I'm going, why does it hurt there? You've got the same spot on the other side, and then that side doesn't hurt. So why? What's going on? What's different on this side than that side that makes it hurt? Right. So I'm always like Sherlock Holmes, trying to figure things out, and I'm checking the body as a whole. whenever I look at the spine, it's never just a neck problem or a low back problem. It's a spinal problem because it's all attached.
Yeah.
If the locomotive's not moving right, well, the rest of the train behind it is being affected, and vice versa. If the caboose isn't right, then it affects, because they're all attached, right? And neurologically, when you look at it, if something's not functioning or moving the way it's supposed to, it screws up everything else. Again, like you said, your body will have to compensate. And you can get away a lot of the times with these compensations for a while. Like if your body goes from plan A of how I bend my elbow to plan B, well, you can get away with that for a while. But eventually plan B starts to fail. And then you go to plan C. And then you go plan D. And those become really inefficient. And then all of a sudden you're like, oh, I got all these elbow problems. And then I check you out and I go, well, actually, your problem is your shoulder. Your brain just got your elbow to do all the bloody work because it was compensating, because your shoulder couldn't do what it was supposed to do. And so your brain goes, well, I'll just get the elbow to compensate. And then eventually your elbow starts to fail because it can't handle. It's not as big and strong as your shoulder is.
Mm-hmm. No, I love it. I love it. Now, listen, we are going to talk. You mentioned the word biohacking, and it's become a real buzzword. I think many years ago, it used to be referred to as trying to be healthy, but now it's called biohacking. And as you say, and I like this idea of a menu of options, and you mentioned a few of them. Sleep and exercise and all that sort of stuff. But one in particular that you're very interested in is this method called wasabi.
Yes.
And I always think of some hot Japanese condiment there, but I think there's another way of looking at it. So tell me, what's with the name? What is wasabi? The wasabi method.
Yeah. So I started we're essentially a shockwave therapy company. And I started with a man named Dave Asprey, who I'm sure you know about. He's essentially the one who coined the term biohacking. They call him the father of biohacking. So he's been doing it for over 25 years, and he's got a massive conference that he runs every year in the States. That I was just there in Dallas at the end of May, and
we spoke to Camilla Thompson and Ezra about the conference. So I've gained a little bit of insight from them, but I'm fascinated to hear your perspective on it.
Yeah, so Camilla and Ezra were kind of helping me out there. They're friends of mine, so they came along. They were helping us out at the booth. And so we launched, we unveiled Wasabi Method at the conference, which was a little stressful because we didn't have much time. Like by the time we decided we would try and go to the conference, it was like February, and we had nothing. So we worked like crazy around the clock. Just like we were signing contracts like at the conference just to get like finalize everything. So that tells you how close to the wire it was. But to tell you the truth, it was mind-boggling how well we did. We were actually, there was probably over 100 exhibitors in the tech hall, and everyone kept saying to us, yours was the busiest booth in the whole tech hall.
Right, interesting,
and
encouraging.
And so we were offering treatments, and they were free treatments using our device, which I have here. You can see I've got the handle so this is the handle of the Shockwave device, which is what we use to treat soft tissues. So essentially the technology is, there's a ball bearing inside the chamber here. So it works kind of like a pistol or a gun, and it's connected to compressed air. And so that compressed air has controlled bursts that come out and push the ball bearing, which hits this tip here. So if you can visualize it, imagine like you're hitting a big gong, and it's making these acoustic sound waves. So this is essentially like the gong. The bullet hits the gong, it creates these acoustic sound waves, and then they travel into the tissue. And when they travel into the tissue, they create all these physiological changes to the tissues they're applied to. So one of the main ones is it causes an almost instantaneous analgesia. So your nociceptors, which are the nerve C fibers, have what's called substance P.
They are the... Hi, Dr. Ron here, and I want to invite you to join our Unstressed Health community. Now, like this podcast, it's independent of industry and focuses on taking a holistic approach to human health and to the health of the planet. The two are inseparable. There are so many resources available with membership, including regular live Q&As on specific topics with special guests, including many with our amazing Unstressed Health Advisory panel. Now, we've done hundreds of podcasts, all worth listening to, with some amazing experts on a wide range of topics. Many are world leaders. But with membership, we have our Unstressed Lab podcast series, where we take the best of several guests and carefully curate specific topics for episodes which are jam-packed full of valuable insights. So join the Unstressed Health community. If you're watching this on our YouTube channel, click on the link below or just visit unstressedhealth.com to see what's on offer and join now. I look forward to connecting with you. To our listeners, they are the pain receptors.
Yeah.
The nociceptors.
Yeah.
They're the pain receptors. Yep.
So they have what's called substance P, which is a chemical that these nerves release to stimulate pain. Now, the nerves only have a certain reserve of substance P. So we're essentially draining those nerve endings of substance P, which will give you a local analgesic effect. So it's similar to like if you eat something really spicy and it burns, like your mouth burns, and then after a while it goes kind of numb. So that's why we call it wasabi.
Okay.
So that's where Dave Asprey came up with that name, because it's spicy and you get that nociceptive effect, the analgesic effect. Yeah. So that's where the name comes from.
Is that very, I mean, I know that in chiropractic circles, something called an activator was often used, which was like a little gun.
Yeah, I have one.
Very specifically. Oh, it's okay. Don't.
I have.
Well, let's see.
It was in my bag. Where did I put my bag? I have it somewhere.
Yeah. No, but it is like, it's a smaller version of what you've just shown me.
Yeah.
Without the sound, I guess.
Yeah.
But is the rationale similar?
No.
Or is it different?
No, that's totally different. It's totally different. So,
okay.
So shock waves are, I'm sure everyone's seen that video, where they drop an atom bomb and they show a little house, what it does to it, and it just obliterates it. Like you see this wave. That's actually a shock wave. That's just a massive, huge one. Mm-hmm. So the way they found out about shock waves was, soldiers were coming back with lung problems after the war. And they found out that when like bombs or grenades go off near a soldier, the shock wave created from these explosions were going through their tissues and actually damaging the lungs. So that's how they actually discovered them. So then they originally used the technology to break up kidney stones called lithotripsy. Mm-hmm. So when you use high energy shock waves, it's catabolic. It causes the breakdown of tissues. Now they noticed if you decrease the energy a little bit so that it's low to medium energy, it causes anabolic or growth like factors to be released. And one of the main ones is what's called VEGF. So it's a vascular endothelial growth factor. And that's one that helps your body grow new blood vessels, called what we call angiogenesis. Mm-hmm. So that almost helps with anything. Like pretty much any soft tissue in the body, if you help the blood flow to that area, you're going to help with the healing. So I tell people, think of blood almost like water, and parts of your body like plants. So if an area like my shoulder isn't getting enough due to an injury, I can't get as much water into that area, then that tissue is gonna kind of wither and it won't thrive. So when I work on that tissue, I'm essentially telling that body, it's like clean up on aisle 5. So even if that's really old injury, if it's 10, 20, 30 years old, it doesn't matter because it's still living tissue. I think a lot of people think our bodies like we're cars or mechanical things that it can't be replaced. It's still living tissue. Even your bones are living tissue. They change. The oldest tissue in your whole entire body is 13 years old. So 13 years from now, you will have grown, every cell in your body will have been replaced with new cells.
Yeah.
So you can make the next generation of cells healthier and stronger than the previous one. Even if you're 80 or 90, you actually can. And so that's this whole idea is we're telling people, don't get stuck on your age. It's how things work. So we want to restore normal function and normal blood flow to that area so it can do what it's supposed to do, which is get blood flow to those muscles, take away byproducts and toxins as well, and help get oxygen to those muscles. And that going back to what you were talking about before with the musculoskeletal and like pain, that's why a lot of people get these chronic problems is because they essentially have hypoxia. These muscles or areas are essentially being starved or deprived of blood flow and oxygen.
Which is what on a very basic level, what massage tries to do, and that is improve the circulation to the area. But you're actually saying this shockwave therapy, wasabi method, is actually stimulating an increase in microcirculation, like improving the plumbing, to flush out the chemicals and bring in the growth factors to stimulate repair.
It stimulates the growth factors, which those cause all the changes. So you get a release. We're causing the proliferation of collagen. We're causing a proliferation of stem cells. We're causing a proliferation, depending on the tissue you work on, you get a proliferation of fibroblasts. So fibroblasts themselves make the collagen. Tenocytes and tendons. So like tendon cells. So your body will like create new tendon in the area, it repairs it and regenerates the tendon. So that's one of the main things it's known for is treating tendinopathies. But also you can treat other things like you can treat erectile dysfunction with it because of the angiogenesis. And some of the other growth factors we were talking about, it causes the release of eNOS, which is endothelial nitric oxide synthase, and nNOS, which is neurogenic nitric oxide synthase, which makes nitric oxide, which we know causes a vasodilation of arteries and capillaries.
Wow, neat. I mean, we've done a lot of programs on nitric oxide as it relates to breathing. I mean, breathing through, that's why nasal breathing is so important because so much, I mean, we had a guest on, Dr. Rosalba Courtney, who said to me in passing, 60% of the body's nitric oxide is produced in the paranasal sinuses only when you breathe through your nose. And I thought, wow, that's a very, very big statement there if ever you needed a reason for breathing through your nose. But nitric oxide is a very important. You want to talk to us a little or remind our listener about what nitric oxide, why it's so important?
Yeah, well, again, it causes the main thing I'm aware of is that it causes vasodilation. So particularly if you have if you have erectile dysfunction, there's the subcategory of vascular erectile dysfunction. That's essentially going to make a huge difference in whether you can attain and maintain an erection is how much nitric oxide you have, as well as using the angiogenesis, because that's the main problem. There's not enough blood flow to the penis, and that's why they can't get an erection, essentially. And we can essentially remedy that with this
Wow,
technology, and then
that's a
non-invasive manner. That's the
yeah.
other beauty of it. It's
I mean,
non-invasive.
I think that is what Viagra and all these other they target that increase in circulation
Yes.
uh, to do that. I mean, I'm looking at that gun and I'm thinking about erectile dysfunction and
Yeah.
wondering, is this used around the base of the penis? Is that what
Yes.
it is?
Yeah. Yeah.
Okay,
We
okay,
actually have, with Wasabi Method, we have education modules. So I've got experts that treat this daily that helped us develop these modules. So we show you exactly how to treat these areas when you purchase our education.
right. Wow.
Yeah.
Okay. So this is a machine that you're looking at for the general public to use, or to put in practitioners' hands, basically.
Yeah. So in the United States, where we're selling, we don't sell it here in Australia. It's an FDA Class 1 device. So it's essentially classified almost like a massage device.
Hmm.
So we actually sell to non-medical lay people. But the caveat there is you're only allowed to treat yourself. You're not allowed to treat others. Okay.
Mm-hmm.
Which no other companies that I'm aware of are doing. Like with the company I worked for prior to setting up Wasabi Method, they're one of the biggest Shockwave companies in the world, and I tried to partner up with them because I'd worked for them for 10 years. And they didn't want to partner up with Dave and I that was one of the main reasons, because they refused to sell to non-medical.
Right.
Even though the FDA deems it okay, they were like,
Mm-hmm.
no, we don't want to do that. And Dave and I we're kind of rebels, and
Mm-hmm.
we want to give people power. We want to be like Prometheus and steal fire from the gods and give it to the people so that they can thrive.
Yep.
You know,
Okay. Are there any downsides to a member of the public who may not be, I mean, are there any adverse effects?
yeah. There are some contraindications which we go through, and we make very, very clear. Actually, I repeat it on almost every slide what the contraindications are. So, like, some of them are like pregnancy, other things that you can't use it on kids, so under 18. That's because of the growth plates. They're not really sure how it affects the growth plates. If you're on blood thinners, or if you have any like hemodynamic problems, like hemophilia, or like you bleed really easy or bruise really easy. If you've had a cortisone injection, but that's the caveat there is it has to be after 6 weeks. So if you had a cortisone injection 3 months ago, you're good. I can work on that area. But if you only had it 2 weeks ago, then I got to wait another 4 weeks for the bolus to be absorbed. Other things, if you have like a tumor, stuff like that, just because it causes the release of all these growth factors. So we don't want to release a bunch of growth factors around a tumor to make it grow more, do we?
Mm-hmm.
Yeah. So those are the main ones. You can't use it over the lungs because it can cause air-filled tissues to expand. So
Mm-hmm.
we worry about possibly causing a lung to rupture or
And when you're using it in your clinic for treating
mm,
chronic pain,
yep.
what sort of regime, how many treatments would one expect to see change? I mean, you mentioned at the conference you were getting good results, presumably in one session,
Yes.
but what is typically a course of treatment look like in a clinic?
Again, it's condition dependent. So
Mm.
if someone's got, like, I had a gentleman I saw today with plantar fascia problem, and he's had it for about 3 years, and he's in his 50s, still pretty active, but for him it would probably. I told him it'll take probably 5 to 8 treatments to get a significant difference.
Hmm.
With that,
And each treatment would be what? How long is each treatment?
I do about 20 minutes for
Right.
a
Okay.
treatment, so it's not that long,
Hmm.
and comparatively, for the cost, like I charge 125 for 20 minutes,
Hmm.
compared to say like if you went and got PRP, which I used to work in at a clinic that had sports meds, they would charge
Just
500.
remind our listener what PRP stands for.
So it's platelet rich plasma. So
Where you take the
yeah, so they
patient's own
take some
blood and
blood
spin.
out of you, they spin it around so the plasma rises to the top, kind of like cream, and then they inject that into usually tendons or muscles that have been damaged or have a tear or some kind of
Hmm.
injury. And they're about $500 an injection, and they usually do at least two, sometimes three. So that's going to cost you $1,000 to $1,500. And the results aren't always, you don't always get better with it. It's
Hmm.
I found in my clinical experience it's about 50-50. I get about
Hmm.
50% of people who get them who go, oh yeah, that really sorted me out, or the other 50 are like, it didn't really do anything.
Hmm.
So it's a lot of money to spend, versus you can come see me 12 times,
Hmm.
for the same
Yeah.
price. And
Yeah.
I
Yeah.
just said to you, it's going to take 5 to 8 visits. So
Hmm.
that's probably half the price of getting a
Yeah. Yeah.
PRP.
Yeah.
Mm.
Yeah. Well, yeah, lot less intervention. Look, it's an interesting. I had not heard of the shock therapy, although
Yep.
the activator. No, that's not like that, and the thermogun, which would be just so that's not even
Yeah,
close. I
that's purely
assume
mechanical. That's
Terragun.
purely
Yeah.
mechanical.
Okay.
Yeah.
But this is actually shock sound
Yeah, they're
wave.
acoustic pressure waves.
Wow.
Yeah.
And variable is it set at one? Does it? Are
Yeah,
there
so
varying?
there's an intensity, so I can increase the intensity or decrease. So that's basically how hard that the bullet hits the tip. So as you increase the intensity, it tends to cause more pain. Essentially, it's not a pain free treatment. And
Right.
like after I put it on people's legs or arms, they're like, "You put this on people's genitalia,"
Yeah.
and
No.
and I'm like, yeah, but we usually turn it down, or you can actually you can get a bit of lidocaine. Like I'm
Right.
friends with a compound chemist, and I'm like, can we use lidocaine? And he's like, yeah, I can make it for you over the counter as long as it's below 10% lidocaine in
Hmm.
the mixture. So we
Yeah.
can use stuff like that as well.
Hmm. Well. You'd need commitment for it, and I'm sure there's enough motivation there to probably provide the commitment for that kind of treatment. Listen, it's very interesting to catch up with you and hear
Yeah.
about that. We'll have links to your site, and I'm assuming you're doing this treatment in Australia now,
Yes. Yeah. I have
but the machine available for practitioners, not straight to the
not
public?
in Australia. Not in
Not in
Australia.
Australia.
Yeah. Yeah.
So you're the only one using this shockwave
Yeah,
wasabi treatment.
there are other devices that you can
Yeah,
buy.
how does it compare to other acoustic shockwave
Yeah,
devices?
so there's kind of different levels. Like the company I used to work for, they always touted themselves as being, the Ferrari of the shockwave um, community. But what they're kind of showing in the literature is you actually don't need the Ferrari all the time. Like it'd be like you having a Ferrari to drive 10 kilometers to work in 60-kilometer zones. It's like, well, you're not going to get you can't use the Ferrari to its full extent, right?
Hmm.
So our device it gets the job done. It might not be as high end as those other ones, but you also don't pay as much, right?
Hmm.
So you don't have the Ferrari price tag going with ours. But it's what the literature is showing is you actually you don't need that level of intensity to cause the physiological changes. There's a range, As long as you're in that range, you're causing the changes. So
Hmm.
you can go higher up, but you're essentially almost hurting the person for no added benefit.
And is there a home of this research, that's being done around shockwaves? Where is most of the research coming out of?
A lot of it's done in Europe. So the technology originates from Germany. So
Hmm.
there's lots coming out of Germany, Switzerland, but China's doing a lot as well. So they've got some pretty interesting research because they don't have all the restrictions that some of these other countries do. So they, like, I heard one study they were doing on infants with cerebral palsy
Hmm.
because it worked quite well with spasticity. So they were essentially treating these newborns and getting crazy effects. Like these kids who would normally be, kind of stuck in a position of spasticity like that, if they treated them straight away, they were causing like these permanent changes and restoring normal range of motion in these kids. Because
Hmm.
at that age, the tissues are so amenable and plastic to allow these changes. And if you can get in there straight away, it's life changing for these kids.
Hmm. Wow, I mean, we'll have to really explore this whole new area of shockwave therapy.
Yeah,
It's eluded me in my professional journey, but I
yeah,
was
yeah,
intrigued by it, and
yeah. We'll have
we'll
to
have
come. I'll
to.
have to come by. I'll show you. Like you can treat TMJ really well with it.
Right.
Yeah,
Okay.
yeah. You can treat
Interesting.
skin. So again, because it helps with the angiogenesis, collagen. So you can treat like scars. I used to work for an orthopedic surgeon, so like right after surgery, I'd work on some of their scars to help with the healing.
Mm-hmm.
You can work on burn victims. You can help with the burns. You can work on things like lymphedema, helps with that. So we actually have a module on advanced techniques. So things like that. We included wounds. It has an
Mm-hmm.
antibacterial effect. So
Interesting.
I read this one study. This gentleman, he was in his 90s and he had a golden staph infection in his forearm and he couldn't take antibiotics. And they treated him for a week with Shockwave and it got rid of his golden staph infection.
I
Like,
imagine that could well be the nitric oxide component of it, because not only does nitric oxide improve circulation, it's also antimicrobial.
yeah, yeah. I'm not sure what the mechanism of action, but
Interesting.
like, yeah,
Yeah,
I can send you
interesting.
that study. It's crazy. Like his arm looks like it's gonna like fall off, and then like a week later, it's all healed up with
Wow,
no
interesting.
antibiotics.
Yeah. Well, Adam, listen, I want to thank you for joining us today and sharing this form of therapy that is certainly new to me and probably new to many of our listeners, but seems to be a very interesting one. We'll have links to your site,
Yeah,
and thank you again.
yeah. Thank you. You can reach me at wasabi_method on Instagram, and our email is info@wasabimethod.com. Happy to chat to anyone that has any questions or comments.
Great. Thank you. We'll have those in the show notes as well.
Awesome.
Thank you so much.
Thank you.
Well, as I mentioned before, while biohacking may well be the buzzword, let's not forget some of the great biohacks that are available to us each and every day. Getting out in the early morning sun to get the circadian rhythm going and the melatonin production and the energy production within each and every cell of your body. Sunshine doesn't get much cheaper than that. And getting out in the midday sun to get your vitamin D. If your shadow is longer than you are, then that sunshine is really not going to be providing you with the vitamin D. And vitamin D is central to the optimal function of every cell in your body. There's other hacks, of course, like sleeping and exercise and good nutrition and rest. But the shockwave therapy is a very interesting adjunct to that. We will, of course, have links to Adam's site where you can get some more information on that. I would encourage you also to join our Unstress Health community. There are so many benefits that come with it, both to your health and financially as well. Some great deals there. I hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well. Feeling stressed, overwhelmed? It's time to unstress your life. Join the Unstress Health community and transform stress into strength. Build mental fitness. From self-sabotage to self-mastery. And together, let's not just survive, but thrive. Expert-led courses, curated podcasts, like-minded community and support, and much more. Visit unstresshealth.com today. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.